Well, February is American Heart Month, a time to commit to a heart-healthy lifestyle and raise awareness of heart disease. This can come in many forms, including atrial fibrillation, also known as AFib. Dr. Mo Jallow from the American Pharmacists Association joins us today from Washington, D.C. to discuss AFib. Good morning, Dr. Jallow.
Good morning.
It's a pleasure to have you on, and it's such an important topic that we're going to tackle today. For people who may not know what AFib actually is, can you cover that for us?
Yeah, so think of AFib as where you have like a regular heartbeat, but it's significant enough that it can increase your risk of having a blood clot, as well as like having heart failure, and probably the worst of them all, having a stroke.
Okay, and so those are some potential complications. What are the most effective ways that people can sort of battle it or at least prevent it?
Yeah, the best thing you can do for preventing like a stroke if you have AFib is taking medications called blood thinners. So the way they work is like they decrease the amount of blood clots in your body. Now the trade-off is that you have an increased risk of bleeding. But one thing that we've kind of accepted in the medical community, in most cases, the benefit of preventing a stroke usually outweighs the risk of bleeding.
Well, and definitely, you know, when it comes to taking medicine, obviously taking it the right way, taking it when it's prescribed, taking it often. What are some mistakes that people make when it comes to that?
One thing I've seen is people maybe just forget to take medications, as well as they suspect that if they don't take it for a couple days, they feel that they could still get by. Unfortunately, that's led to so many people actually being admitted into hospitals because they would have a stroke because they weren't taking the medications that they were supposed to. And unfortunately, that's cost over like $100 billion, and yeah, billion with the B, dollars and cost, because people weren't able to take their medications. And this is something that I would say is pretty significant.
That is significant, and it's shocking. So what would you say the role of the pharmacist is in helping people really understand not only how to take their medication, but the risk of not doing it?
Yeah, I would say pharmacists, we're like the medication experts of the healthcare team. We know everything there is to know about a medication. We know like how they work, why they work, as well as what are some benefits, as well as what are the side effects. And we can even provide some tips about what you can do to prevent you from having any of these side effects of these medications. And we can even provide tips to make it easier for you to remember to take your medications as well.
Well, definitely there is a sense of comfort in, you know, when you go and get your prescription, having somebody who really knows the medication and everything that it can do for you, and also how you should use it. Now, let's talk about the other side of staying healthy, which is definitely something like exercise. So how important is that in conjunction with the medicine?
Yeah, I would say lifestyle recommendations such as exercising daily, eating well, such as increased amount of fruits, increased amount of vegetables, is one of the key things you can do to keep you healthy, regardless of what disease you have.
Definitely, good point. Now, Dr. Jallow, is there anything you want to leave us with before we get going?
Yeah, if people want to find out more information about what they can do to keep their heart healthy, they can go to the American Heart Association website. And I think they usually do a good job of providing information that people can use. And they even can go to the American Pharmacists Association website, because they can learn a little bit more about medications and what are more tips about what you can do to make sure you can take your medications.
Well, Dr. Mo Jallow, this has been extremely helpful for anybody who really wants to stay healthy and keep their heart pumping the right way. I want to thank you for taking the time this morning to talk to us.
Thank you for having me.
Absolutely. Now stay right where you are. The Morning Blend, we'll be right back.